Welcome to our channel HASHMICLINICS.
All right, let's dive right into a concise explainer on a fascinating remedy, Cimicifuga Racemosa, which you might also know as Actaea Racemosa. We're really going to focus on the distinct keynotes, the things that make this remedy just pop, so you can spot it in your practice.
So where do we even begin? Well, it all starts right here, with the most profound keynote of this remedy. This isn't just a case of the blues. We're talking about a deep, heavy psychological gloom. This sensation, this feeling of a heavy black cloud, is the absolute core of the Cimicifuga identity. It's the source from which pretty much all the other symptoms radiate.
And this black cloud we're talking about, it manifests as a very specific mental state. The old texts call it a mania of sorrow, and that's a perfect description. You'll often see this picture in conditions like puerperal mania, where that mental turmoil after childbirth is just so profound and overwhelming. See, this isn't a passive gloom. It's active, it's agitated, and it's just filled with fear.
And this is where it gets really interesting, right? You see this unique combination of symptoms. You have this profound melancholy, but it's paired with these, well, frankly, bizarre and specific fears. The patient isn't just sad. No, she's suspicious, she's restless, and she is absolutely terrified that she's losing her mind. And then you get these classic, strange, rare, and peculiar symptoms, like the illusion of a mouse running from under her chair. It just paints such a vivid picture of her internal state of nervous hypersensitivity.
Okay, so from this dark mental space, where does the pathology go? It radiates out, and its number one target, its primary physical battleground, is the female reproductive system. With Cimicifuga, the connection between the mind and the uterus is just incredibly strong. In fact, you'll often find that the mental state is a direct reflex of some kind of uterine or ovarian irritation. Now this right here is a huge one. This is probably the remedy's most characteristic and unusual keynote. You know how for so many remedies, the moment the menstrual flow begins, there's a sense of relief, the pain gets better? Well, with Cimicifuga, it is the exact opposite. The more profuse the flow gets, the worse the suffering becomes. This paradoxical modality is just such a powerful confirmation when you see it.
And when your patient describes the pain, you've really got to listen closely to the quality of it. We're not talking about dull, heavy, congestive aches here. No. Think sharp, think shooting, think electric-like pains. It all points to a profound irritation of the nervous system. And notice how erratic the pain is. It's darting from side to side across the uterus, it's radiating down the thighs. In labor, this can show up as these spasmodic, tedious, ineffective pains with a rigid os, often with those characteristic shivers in the first stage.
All right, so we've seen the mind, we've seen the uterus. Now let's follow the path and see where this disturbance radiates next. It's fascinating, really, because that same nervous irritation that's tormenting the uterus and mind also takes aim at the large muscles, especially the ones in the back and the neck.
Now, this is a really key distinction. We're not talking about your typical joint-centered arthritis. No way. Cimicifuga's action is on the fleshy part of the muscles, the muscle bellies. This myalgia is often described as being of neurotic origin, which makes sense. It's common in those sensitive, nervous individuals where the physical pain and the emotional distress are just deeply tangled together.
The cervical spine is a huge target here. You'll see patients with this intense stiffness and contraction in the neck and upper back. The spine itself can be so sensitive they can't even stand the pressure of a chair against it. And here's a wonderful little keynote to listen for, the aggravation from fine motor tasks. The pain is brought on by things like sewing or typing or playing the piano. It just perfectly reflects that neuromuscular tension.
And the headaches. Of course, the headaches are just as intense and dramatic as the rest of the picture. The signature sensation is this violent, bursting pain, as if the top of their head is just going to fly right off. Or sometimes they'll describe it as a feeling of the skull opening and shutting. And very often, these headaches are a reflex symptom, tied directly to that irritation in the uterus or the spine.
So it's really helpful to think of Cimicifuga as having two different faces, two ways it might show up in your practice. You might see it in an acute state with these really violent, spasmodic symptoms, things like chorea or even convulsions. Or you might encounter it in a chronic case, defined by that deep, persistent black cloud and that characteristic rheumatic muscle pain. Okay, modalities. As you know, this is absolutely critical for getting the prescription right. You really want to notice the strong aggravation from cold and from any kind of emotional exertion. See how that ties the rheumatic and the mental spheres together?
And of course, the grand keynote we keep coming back to. All the symptoms get worse during menses, and the suffering ramps up as the flow increases. On the flip side, warmth and rest generally brings some relief.
So, to really nail this prescription, to feel confident about it, you're looking for these 3 distinct areas to all come together. Think of it like a 3-legged stool. You've got the black cloud mental state, you've got that paradoxical menstrual profile, and you've got the myalgic pains in the neck and back. When you have all 3, you have a really strong case for Cimicifuga.
So, let's wrap it all up with this one question to keep in your mind. When you see a patient whose black cloud of sorrow seems to be triggering a physical storm of these erratic electric pains, you've got to ask yourself, could Cimicifuga be the answer? It's a powerful image to hold on to, and it gives you a really clear, memorable picture for your practice.
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.